Welcome to All Things Cardio-Oncology. My name is Steve Caselli. I'm the Executive Director of ICOS, and in this podcast, you'll hear from a diverse representation within our community. We want you to be both informed and inspired by their stories and experiences, and we're so glad that you've joined us today. Well, it's a pleasure to have with us today the co-editors of an important new textbook on cardio-oncology, the Washington Manual for Cardio-Oncology. Our three guests today are Dr. Daniel Lenihan, Dr. Josh Mitchell, and Dr. Kathleen Zhang. These three were working together at Washington University in St. Louis when they produced this volume. And of the three, only Josh is still there. So Dr. Mitchell, it's so good to have you with us today. Thanks for your time.
Thank you. It's good to be here. It's good to have the team back together. It's always great to hang out with Katie and Dan again. It was great working with them, and always good to run in their paths again.
And Dr. Kathleen Zhang. Katie is currently at UT Southwestern in Dallas, Texas. Katie, thanks for joining us today.
Thanks, Steve, for having me. It truly is nice to have the whole gang together again.
And of course, we have with us again Dr. Daniel Lenihan, who is a regular with us. And so we're always thankful to have him on the program. Dan?
If anybody doesn't recognize my name from that, I'm a past president for ICOS and a founder, and really enjoyed working with Josh and Katie at WashU. And this textbook was a great product of that partnership. So thank you for asking us about it today.
Well, thank you all for joining us today. And before we actually get into the content of this volume in particular, I wonder, Dan, if you could just tell us a little bit about the Washington Manual series in general and how this volume fits into that broader project.
Well, I can only truly describe my personal experience with it. So Josh and Katie may have a slightly different view, but certainly the edition that I used, which was many editions ago, was a faithful companion for me in my white coat pocket when I was particularly an intern and a resident. And it was a vital key for surviving rounds, and it had great summary and concise information, just enough to make sure that you knew the critical features and you didn't miss anything really important. So I found it to be a critical adjunct to my residency training. So that's the original WashU manual, which was classically for internal medicine. And as I mentioned before, the version that I used was in the previous millennium, so it was a much older version. They've done many versions since then. In addition to the WashU manual for internal medicine, they've branched out into a number of different other categories. So those include echocardiography and cardiology consultations, as well as several other specialty books, including, I believe, stem cell transplant and other sort of WashU manual type summary topics. This particular version is for cardio-oncology, which is the first one definitely in the WashU manual series, but it was really the first text that was intended to be essentially in your coat pocket and a resource for you to use on day-to-day rounds or practice, and a way of getting some important insight, immediately present so that you could help make good decisions. So that's the nature of the WashU manual, and certainly in my medical training, this was an absolutely must-have sort of version of summary for internal medicine, and we were hoping that it would do the same for cardio-oncology.
Thanks, Dan. That's really helpful and serves as a good introduction for those who may not be familiar with this series. Katie, I wonder if you can describe for us how you think this volume is going to be used by clinicians in particular.
Yeah, so I think another really important point to highlight is that this Washington Manual series is really meant to be a practical textbook, as Dan was mentioning, carried around in your white coat pocket. The subtitle of our textbook is A Practical Guide for Improved Cancer Survivorship. So again, practical. And, I would say that there's definitely a need for this in the cardio-oncology space. The issues that we deal with on a day-to-day basis in cardio-oncology, they're so very varied and diverse. We're really covering not only the full spectrum of general cardiology care, but also the full spectrum of oncology care. And there are a lot of details that, it is not, for which it is nice to have kind of a pocket-sized handbook at your fingertips to refer to. And I think as the field continues to evolve rapidly, there will be more and more, drugs and, dosages, toxicities that, will pop up, and it'll be really nice to have kind of this practical go-to handbook to refer to.
Well, this sounds like it's going to be a really helpful resource for a lot of different people. Josh, I wonder if you could elaborate on that and tell us, in your perspective, what kinds of providers do you think this is going to be most useful for?
Yeah, that's a great question. The book really helps fill a really important gap right now because cardio-oncology is an exploding field. It's new to a lot of people, but it's really an exploding field as we have an increased number of patients with cancer getting treated with an array of different cancer therapies and increased cancer survivorship. There's a growing population of patients who have been exposed to these cancer therapies in the past. And as that population need is growing, I'm constantly sought out for how do these other centers expand their cardio-oncology offerings and how do providers start to get trained in cardio-oncology. And this book is a super helpful resource for anyone practicing in cardio-oncology, whether they're a trained cardio-oncologist to use as reference for things that they may not encounter as often, whether they're a cardiologist who has done great general cardiology, but just really hasn't been exposed to cardio-oncology as much and wants to understand the best way to approach these patients in a really practical way, or even for internists, because really internal medicine providers really will see these patients a lot during their treatment or survivorship to have a better understanding of what's going on. And it's really important information because as this cancer therapy is growing and many more patients are being treated for it, it's increasingly likely that non-cardio-oncologists even may encounter these patients. And so having a helpful, useful resource to approach these patients is becoming essential.
If you or your institution would like to have credentials that confirm your qualifications as a cardio-oncologist or a cardio-oncology center of excellence, we encourage you to consider applying for our certification exam in cardio-oncology or our certification for centers of excellence. These are the only certifications currently available in this field, and it's a special opportunity for you or your institution to distinguish yourself, recognizing your expertise in the field. More information about both these opportunities can be found at ic-os.org, or you can email directoricos@gmail.com for more information. Well, as you all know so well, this discipline is so multifaceted, involves so many different kinds of care providers. It's wonderful to have one tool that'll really address all the various needs. And as has already been said, it's also a field that is changing so rapidly. So Dan, I wonder, what have you done in this volume to ensure that it is really up to date?
Yeah, I mean, that's a major challenge for any, review manuscript that you would do or any book, anything, the way that information changes so rapidly in the medical arena that, by the time you finish a book, you feel like it's outdated. We we were really cognizant of this idea. And so every chapter in the book is as contemporary an information as we could find. And we actually, from the beginning of the development of this book to the publication was not that long of a period. I think it was grand total was less than a year. So we really kind of pushed hard to keep the information as contemporary as possible and also provide important synthesis. So if there were several maybe disparate points of view, we tried to synthesize them into a practical way of approaching a particular problem. So I think that, of course, we're biased because we worked on it, but I feel like this at this moment is very contemporary, probably as contemporary as any book could be for this field, and hopefully people will like it enough we'll do a second version at some point. But at this time, I would say all of the chapters were written by people that are active in the field. They are aware of the data that exists, currently, and they try to incorporate the most contemporary stuff in each chapter and then synthesize it in a way that made sense. So, yeah, I think no publication is going to be perfect in any way, but I do feel very good about this one, that it is up to date, it's concise, and there are many unique presentations of how to synthesize a wide field into a meaningful algorithm or process for how to manage your patients.
Yeah, I was just going to add something to it because I think it's such an important question and one to make sure to comment on. And Dan really brought up several really important points, but I just wanted to emphasize the fact that the book's really designed to provide a good framework for how you approach the patient with cancer and heart disease, both before, during, and after treatment. And that framework and that foundation is solid and unlikely to change significantly for some time and will continue to be relevant. There will likely be new medicines in the future that we can only hypothesize on, and it will certainly be reasonable to update the book when we need to. But there are several non-changing foundational points that the book addresses to help clinicians approach these patients.
That's helpful. Thanks, Josh. And Katie, I wonder if you could comment a little bit on just sort of how this manual is organized and therefore how it'll be useful to those clinicians who are, at the bedside dealing with patients.
Yeah, so the whole, the book is divided into chapters. And within each chapter, it's actually all the text is bullet by bullet points. So I think that really facilitates the readability of the text. And then really, as editors, we really made an effort to ensure that any sort of main points were highlighted, either bolded in the text or with dedicated tables or figures kind of listing, really key treatments, key diagnostic tests, key side effects, things like that, in a really visually appealing format so that the busy clinician can easily refer to it and take away the high yield points.
That sounds super helpful. And Dan had sort of jokingly mentioned at the beginning, being old school and having a Washington Manual in his pocket. Is this a pocket-sized volume, similar to what he was describing? And related to that, do you think that it would be more effective in an app form that somebody could put on their phone? And is that even an option?
So the book size, it is pocket size. So, the white coats tend to have those somewhat wider pockets. So this really easily fits in there. I guess I'm kind of old school too. I kind of like having a physical book that I can open up and dog ear the pages that I like and, quickly refer to. I believe that there is kind of an electronic version of this book available as well. And so, for people who prefer the electronic format, we're very happy to have that available. The other nice thing about the electronic version is that, many of the topics that we cover kind of fit into multiple areas. Some things, for instance, might fit into like a vascular disease section, but maybe this chemotherapy also causes heart failure. And so, whereas with the physical version, you'd have to look up the index, the electronic version might be nice because you could search the text itself. So, to each his own, I would say.
That's good. And hopefully having options be helpful for people as well. So that's a good thing. And then maybe, you could all sort of comment on, you all worked together at WashU at least for a season. And while this book was under production, how do you think that contributes to the quality of a project like this, being colleagues and working together?
Yeah, I think, I'm happy to take the first stab at this one, but the key piece is that, as we were developing this book with the, sort of the original WashU Manual for Internal Medicine in mind, we were really trying to be a useful guide for people that have to make decisions, in front of patients or, in the arena of patient care. So, we are not necessarily trying to, do the extensive literature review for every paper that's been published on a particular topic, et cetera. It was more, how can people utilize this information to make a decision at hand? So with that in mind, before we even started this project, we went through different areas and we came up with a sort of a combined approach. Now, that didn't mean that I would only do things a certain way and Josh would do it a certain way that he does it and Katie does it her way. And we didn't squish them all together. What we tried to do is integrate all three patterns of behavior and summary of the information into a meaningful summary. And so we did that for a number of areas, and those were incorporated into the chapters. So I really feel that, the fact that we were working together in the same, environment essentially allowed us to really, come up with things that were common and as Josh mentioned earlier, really foundational for how you approach a patient. So I think that was an essential piece, and it really, in my view, it really allowed the book to have clarity because of that ability. So,
Josh or Katie, would you add anything to that?
Yeah, I think that's very well said. Really, it was a great product of such an amazing collaboration between the three of us, but also all the authors. Really put together some great chapters, and it was made possible by our ability to work together. And certainly you can look back and just recognize how great of a time that was, that all three of us were at the same place to be able to help guide this book into completion. And I'm so proud of how it turned out, because it really is such a useful reference that spans so many very useful topics that can be tough for many people as they approach, and it tries to break those down and give important, facets for how to approach these patients. And so we do have consistency. WashU is maybe the only place, but at least one of the few places with a robust inpatient consult service that's, comprehensive and always there. And so all the people on this book have a lot of experience treating inpatients with cardio-oncology problems, as well as outpatients across the spectrum. And that experience, really shines through as you go through the chapters and you see the overall approach to these patients.
Yes, I want to echo what Josh mentioned right there, kind of the collective experience across the authors and editors on this textbook, I think is really unique. not only with the inpatient experience, which is critical, but also just, with the breadth of oncology and cardiology expertise that's represented in the book. I think it's somewhat unusual to have a center that is so strong in cardiology with kind of the full service array of cardiology services, but also in oncology as well. So I think, the readers will find it to be a really kind of rich resource just based on the collective expertise of everyone involved.
Well, you all have created a really valuable tool for the cardio-oncology community. So I know hearing this, another number of people are going to want to get their hands on a copy. So Josh, how could somebody get a copy if they want one?
Yeah, that's a great question, Steve. We will post a link for sure on the website. It's certainly available through Amazon and basically most, if not all, book publishers, or direct from the publisher themselves, Wolters Kluwer. But for those who are familiar with Amazon, that may be the easiest place for people to find it.
That's great. And we'll definitely put a link in the show notes for this program as well. Well, any other closing comments that anyone wants to wrap up with as we think about this project?
No, I think, for the most part, I would say it's very exciting to see this manual come out because of all the collaboration and all the effort that was placed, over the past year to really get it pulled together. So, I mean, it's super nice to see the final product, and it not be 10 years after you did the work on it. So I think that part is really good. And, I'm very excited about, the field in general. Hopefully they will be, the various collaborators that we have around the world will see that it's a useful resource, and then there'll be a reason for a second edition.
Excellent. Well, thank you all for being on today and talking to us about this exciting new resource. You all should be very proud of the good work you've done. Thanks for joining me today.
Thanks, Steve.
Thanks so much,
everyone.
Steve.
Thanks, Steve.
For more information about ICOS, you can go to ic-os.org, where you'll find more information about all of our programs, including our weekly webinars, our board certification exam, and other resources that we know you'll find helpful. Thanks for joining us today, and we hope to hear from you soon.